So our global program has three focus areas. One of them is prevention of cancer. So we work specifically on smoking cessation and then HPV, so vaccination and screening for HPV. Then we have a second program, which is on capacity development. That team works with local cancer societies to improve kind of the civil society support around cancer. They also work a little bit on patient support programs such as transportation, lodging, and navigation. And then the third part of our global program is access to treatment. And so there we work on access to chemotherapy, radiotherapy, surgery, and pain relief, with a focus on reducing the cost, improving availability, and also getting services delivered in a more timely manner. So the American Cancer Society has Memorandum of Understanding with Ministries of Health in Sub-Saharan Africa. And then in several of the countries, we have staff who actually sit in the Ministry of Health and work on cancer programs for that government. It is. This is the early days. I mean, I think that what we're seeing is there is very little treatment now, but the treatment is expanding pretty rapidly. So most governments in Sub-Saharan Africa are investing quite a lot of money to expand cancer treatment services. So we have new cancer centers opening in several countries. We're also starting, just in the last 5 years, we're starting to see the introduction of fellowship training. So now we can train oncologists in Africa instead of sending them abroad. We have nurse oncology training programs coming on board. We have a lot of new radiotherapy resources that are coming online. So I'm very hopeful because I've seen a tremendous expansion in cancer services just over the last 5 and 10 years. So I think that what's happened is that as cancer cases have grown, the governments and the health systems in these countries are responding. But the institutions around them are still trying to develop that response. So there's not a lot of funding available. A lot of the major funders in the global health community have yet to take on cancer. So that means that most of the financing for cancer treatment comes directly from patients. So in countries that don't have health insurance programs, it means patients have to bear the full cost of treatment, which, as you know, can be quite expensive. And that's part of why it's been slow to develop, but it is moving. And there's a lot involved. So we often talk about the leaky pipeline to cancer treatment. And by that we mean that there's a lot of barriers along the way. So from the time that a patient first develops symptoms of cancer, they're going to have to find a way to get in to see a physician. And that step alone, many patients will fall out because they live far from a health facility or their health facility isn't well resourced. But once they get there, then they'll usually need some kind of workup, usually imaging, and that can be costly. So they have to find funds for that. And then once they get that done, there's usually pathology required. So there's all these steps before they even get to a cancer center. Either well off or very lucky. So some patients get through it because there are programs, but the reality is that for people who don't have resources, it can be extremely challenging to get to cancer treatment. It's true. And people who have resources oftentimes are able to go abroad or they're able to access services in their country. But we do have, I think, a lot of challenges right now in terms of both financing and then getting patients through a rather complex system. And the end result is that at the cancer centers, even if we have treatment available, by the time patients can get to those cancer centers, if they're coming from far out in the country, they're so advanced at that point that the treatment that we give them isn't going to be very effective. So we're constantly challenged, I think, to try to expand our cancer treatment so that we can start getting patients in earlier, and then we'll really have a chance to treat them. This is very similar to what we saw in HIV about 15 or 20 years ago, which is that before we had treatment for HIV, we had the same thing. We had very few patients able to access it and patients having to spend a lot of money to get to treatment. By the time they got to us in HIV, we often weren't able to do much for them. What we found back then was that by expanding services, by having more HIV treatment, and once we started being able to get the prices down, patients were able to get more treatment, and then we started getting patients that we could actually treat and save. So I think there's a lot of similarities. So a few of the developments that I think are going to be the most exciting for us are, one, I think we're going to see a continued expansion of training programs in the region. So once African countries can start training their own oncologists and their own oncology nurses and pharmacists, they'll be much better able to get a handle on the problem. So that's going to be really important. The second thing is that I think we will see prices come down. So we've already seen some movement in the prices for chemotherapy and radiotherapy in several countries. So as the volumes increase, we can start taking targeted steps to change the market so that people get more affordable treatment. I think that will be really important. We're also starting to see the expansion of health insurance coverage for cancer. And in the places where that has happened, such as Kenya, we've seen a huge expansion in the number of people getting treatment and able to complete treatment quickly. So I think those are three factors that are going to be really important. And then I think another one is if we can start to get more financing for cancer treatment from global health funders like the Global Fund and others, I think that will also be a breakthrough that will help us to really kind of expand services quickly and get more patients under treatment. Yeah, so the HPV vaccine is a very important development for preventing cancer. I mean, cervical cancer is the #1 cancer in Africa. It is entirely preventable through vaccination, and that vaccine is relatively affordable. So I think in terms of long-term solutions, this is a center of any solution that we come up with. In the short term, there are challenges around availability of the HPV vaccine, so there are not enough doses right now to supply everyone. And this is one of the challenges that we have, which is that when we negotiate for lower prices for some parts of the world, when there is a shortage, then companies are not incentivized to sell in those parts of the world where profits are smaller. So I think there is going to be, in the near term, some challenges around availability of vaccine. But at the same time, I think if we can get vaccination built into national strategies, once we solve some of that supply side, then we can start focusing on the demand side and getting girls vaccinated. I can tell you that Gavi, is very much behind the HPV vaccination programs. So there's a lot of support coming from Gavi to expand access to those vaccines. I expect we would see that from other international actors as well. It's a really good solution, and it's a really good buy for cancer prevention. In terms of the pushback that we see in the U.S., I don't think it's necessarily a given that we would see that in other countries, and we haven't seen it in sub-Saharan Africa. A lot of that is political, and I think the challenge for us is just to get people accurate information and then to roll these vaccines out in a way that it makes sense in kind of the cultural context that it's delivered in. So, and I think too, people in the U.S. aren't used to seeing a lot of cervical cancer because we've had strong screening programs. So whereas in sub-Saharan Africa, I think people are aware that cervical cancer is the #1 cancer. So it is something that people have a lot more awareness about than we do in the U.S. So the American Cancer Society has some projects in Latin America, mostly around our prevention programs. But when it comes to cancer treatment, our focus is sub-Saharan Africa.